Good evening, class. My name is Whitney Wells, and the title of my MSN project is Geriatric Heart Failure. My population of interest are geriatric patients with heart failure. Heart failure is responsible for many hospitalizations within this population. This population is underrepresented in clinical trials. The issue of concern is medication adherence. The five sub-roles of the advanced public health nurse are the researcher, consultant, administrator, educator, and clinician. And for this project, we will focus on the educator, which is to provide health education within the nursing framework. Healthy People 2020 has a systematic review that addresses medication adherence. It states that text messaging interventions has shown to increase medication adherence in patients with chronic diseases such as heart failure. The interventions included are education on the importance of taking heart failure medications, education on prescribed medications, mechanism of action, class, dose, route, time, and side effects, and also implement programs designed to encourage medication adherence. The literary review chosen for this project is Heart Failure in the Elderly. The article states that 80% of cases of heart failure are among age 65 years or older. Heart failure is responsible for many hospital admissions, and also, like we stated, the major concern is that this population is underrepresented in clinical trials. Some environmental, individual, and aging factors include, of course, aging, lack of physical activity, comorbidities, cognitive and mental issues, polypharmacy, and also a lack of resources. The three scholarly articles included for this project include a systematic review, which has medication adherence interventions and how they improve heart failure mortality and readmission rates. Most interventions included medication and disease education efforts. The second article is a randomized control trial. Within this, the pharmacist delivered health literacy intervention was looked at. Results were measured by adequate versus inadequate health literacy and impaired versus non-impaired cognition. The interventions yielded no significant difference in patients with cognitive issues, but did reduce hospital admissions for low literacy participants. The third scholarly article was another systematic review in which described medication adherence as the most important self-care behavior to prevent heart failure exacerbations. The review found that medication adherence is an important modifiable factor in reducing poor outcomes. A rapid appraisal of this particular pieces of evidence included the systematic reviews were consistent with issue in question, information from multiple areas was reviewed, biases and limitations were addressed, and recommendations for further practice were made within these evidence. Within the randomized control trial, true randomization was used. All investigators were blind to treatment assignment, and appropriate statistical analysis was used. This is a pyramid of the primary, secondary, and tertiary prevention efforts. At the bottom, you'll find the primary, which is the largest section. It incorporates education as its primary principle. The secondary prevention effort is providing screenings. And the very top, you have tertiary prevention, which is preventing further complications. My focus is primary prevention. The most effective interventions within the sub-roles for this project are the consultant, which can provide resources to make medications affordable, provide low literacy aids. The clinician can be the direct provider, assessing baseline and monitoring for changes in status, and also can administer medications. The researcher, of course, can conduct research based on the needs of the population and also provide further recommendations for research. The administrator can oversee interventions provided to patients within the community to help encourage medication adherence. The most effective intervention for this particular project is, of course, the educator, who can educate on healthy food choices, exercises that can be done with limited mobility, general information on medications given, the importance of taking these medications as prescribed, and symptom management. The theory used for this particular project is the Kolb's cognitive learning theory. This theory focuses on reflecting, learning, and applying key principles that are taught. This theory also has a component of hands-on experience, making the learning experience more of an experience for the patient. Summary of the needs assessment. Geriatric heart failure needs more research on interventions and medication adherence interventions. The plan is to create a heart failure management course for heart failure patients with their caregivers within the community, geared to teach patients the importance of sticking with the treatment regimen given at discharge. The proposed plan also includes a pharmacist-led intervention, which the pharmacist can collaborate with providers and also provide resources for the patients. The registered nurse and/or case management-led interventions include providing that personal connection with the patient and providing disease management and lifestyle modification, in addition to medication education. The handout used for this particular project was simple and had accurate terminology. According to the Flesch-Kincaid scale, it could be read easily by a 7th or 8th grader or 13 or 14-year-old. And also, it contained very pertinent information to the topic, like discharge checklists, lifestyle modification, and symptom tracking information. And this is a link to the handout. Birmingham, Alabama was the location chosen for this particular project. It's miles north of the Gulf of Mexico. It's about 151 miles long and sits between the foothills of the Appalachian Mountains. Birmingham is best known for its mining industry. It was hit hard after the 1930s Great Depression. And even though all of these setbacks happened, there was a lot of segregation, racism, Birmingham still remains one of the largest cities in Alabama, and it has a thriving economic system of healthcare, engineering, and transportation. And that's according to Birmingham history. The local governmental structure includes the mayor, Randall Woodfin, who was elected on November 28, 2017. His goal is to create an ecosystem for entrepreneurship to thrive in a city built on steel industry. The city also has council members, and each council member heads a district within the city. At the bottom left corner is a picture of Mayor Woodfin and I. Key leaders within his community are Dr. William Fernandes, who is the CEO of UAB Health System. UAB is one of the nation's top medical institutions, so it only makes sense that he is a key leader within this community, along with other CEOs of hospitals. Dr. Mark E. Wilson is the Jefferson County Health Department CEO. He oversees a $55 million budget with a mission to prevent disease, assure quality health care, and protect people against public health threats. Republican Richard Shelby and Democrat Doug Jones are our state representatives. District 6 Republican Gary Palmer is the district that covers the Birmingham area in our state representation. This is a map of Congressional District 6, which the project took place. The health policy chosen for this particular project is the building environments and the public health workforce to support physical activity among older adults. This policy was chosen because it directly correlates with heart failure geriatric patients. The ANA Code of Ethics has Provision 7 that states, the nurse in all roles and settings advances the profession through research and scholarly inquiry, professional standard development, and the generation of both nursing and health policy. Health policy advocacy. Nurses can advocate for policies by, of course, performing in the consultant sub-role, presenting policy to the state representatives along with evidence-based practice to support these policies, and collaborating with other community members because we are stronger in number. Birmingham, Alabama consists of about 210,000 people. About 3% of this population are geriatric, age 65 years or older. Some of the most common chronic diseases include asthma, COPD, lung cancer, high cholesterol, and high blood pressure. Summary of the windshield survey. Within the community of Birmingham, the actual project took place in a small community. This community comprised of mostly African Americans. One side was very well kept, while the other side seemed to be neglected. There was no fully functional recreation center, no readily accessible health care. There was also a lack of businesses within the area, and a lot of the buildings look abandoned. The first two interviewees had very similar concerns, which was education, of course, and resources. The RN that I interviewed had a different perspective. She felt as though it was the readiness of the actual patients or the community to receive information that was the issue. But the common thread between them all was education and more resources. The three priority diagnoses are listed here, and this is based off the needs assessment and the interviews as well, and the windshield survey. The primary community diagnosis is risk of ineffective health management among geriatric heart failure patients in the community related to inadequate medical facilities, educational programs, and emergency responders, with the focus being on educational programs. Feasible interventions are listed here. As you can see, the first two are educating on the importance, educating on prescribed medications. Also, implementing this actual program is a very important intervention based on the evidence received throughout the project. The outcomes or objectives are listed here. By the end of the project, the participants are expected or hopefully will have learned these 6 key elements. The project is to create a heart failure management course for patients and their caregivers within the community, geared to first and foremost teach, educate, also utilizing the pharmacists for resources and providing educational handouts, providing pill organizers, and just teaching the patients on heart failure management as it relates to adhering to their medication regimen. Resources utilized were my Ports Pathology 9th edition textbook. We also used blood pressure cuffs and pill organizers as mentioned earlier. A pharmacist was not available and we did not need a HIPAA waiver. Audio visual via projector was used and the educational handouts. Some barriers included health literacy of the participants, patient motivation, lack of doctor follow-up and or insurance to be able to follow up, finding a willing pharmacist, and resources needed to buy blood pressure monitors and scales. Fortunately, those were provided by the community center that the project was implemented in. The team members included just myself as the nurse. I also had a pharmacist follow up behind the scenes to make sure that I was presenting accurate resources and information to the participants, and one tech person that helped with my projector. The key stakeholders within this community are the healthcare personnel, such as public health workers and hospital workers, public health officials like the CEO and the Jefferson County Health Department CEO, as well as the community. The goal of this actual project was reached, in my opinion. The educational program was taught to participants. It was based on the evidence yielded within this whole entire project, where education was the key focus. Medication adherence is one of the most important issues for this population, among other issues. I did decide to focus on medication adherence, and my project was geared more towards that. Thank you so much for listening. And these are my references, which were also referenced throughout the PowerPoint. Thank you.